Okay, so just to kind of pick things back up a little bit more quickly. So med profile, again, is where you would see basically all the medications for your patient. When it comes to interventions, this is a huge category. So you have scheduled interventions in PRN. If you're under your scheduled, your daily to-dos are going to be on your screen. The big thing is the narrative note. We'll talk very quickly about the narrative note, but that's a requirement every couple of hours. So if your shift starts at 8 o'clock, your first note will be dated and timed, for 8 o'clock. For your narrative note details, okay. Once you have your narrative note, depending on how you feel about CupHub, that's something that you can copy and paste and use over and over again. It does not disappear. If you go back to your narrative note again, and you need to do one for 10 o'clock, okay, every 2 hours. These are your scheduled tasks and the medications that you would need to do every hour. If it's in red, you can see it'll be past due. So those are my tasks for 7. If I went down for the rest of the shift, it'd be my 8 o'clock task, 10 o'clock tasks. And again, back to daily to-dos. If anything significant happens, I can just go to the narrative note. I would enter the time of the significant event. I could do a voice note or whatever you desire, and you could submit that. You can also go to a history. And this is actually a history of interventions. So I'm putting kind of the cart in front of the horse, but I just wanted to show you that. PRNs, so I's and O's. We want to document everything that happens during your shift as best as you know it to happen. So you don't have to be crazy. You don't have to you can approximate, but honestly, this is only to benefit our patients. So input and output. Every time there is an oral feed, a tube feed, a flush, if a patient has a central line because they have TPN, if a patient is incontinent and has diapers, a Foley, if they're being straight cath, if they have an ostomy, an ileostomy, if they have an episode of emesis, output other, again, if the shoe fits, if it fits in that category, whether it be they're diaphoretic and they're sweating a lot, maybe they have an ostomy, an ACE, mitrophanol, output other. If you're suctioning your patient, I want you to know it's not always the amount, it's usually a count that we're using, okay? And then the type of suction, tracheal, nasal, oral, any category, you would take care of it there. As you can see, it stopped me because I can't have an empty intervention time, so I'm going to make sure that's up to date. Man, I'm really glad that this thing is being so particular. So I have a count because it's telling me, warning, you already completed a task at this exact time, continue, that's fine. But again, those are all my scheduled PRNs. Input, output, PRN interventions. If a patient is having a seizure, for example, this is a place where you could document any kind of seizure activity. If there was thick secretions and you wanted to do a lavage, there's an option here. PRN for vital signs is here. Any PRN would be listed here as a possible option. So that's PRN interventions, PRN medications, a few noted. Again, if your patient's having pain, if they're febrile, you would type, you would put the time, and you would follow the form. Honestly, I feel like that's very, very user-friendly. Complete a task. This will let you know what was done versus oral, tube, flush, IV, other, completed interventions. Now, if you're staying for tasks outside of your visit time, okay, when it comes to completed interventions down here, again, the narrative note that I entered at 8 and 10, you could see those notes here. And then output, again, you would go on this list and you can take a look here. Last but certainly not least is entering orders. So whenever you're at a patient's home, you're going to be getting new orders. If I go to this plus sign, physician, this is the patient's PCP. Say that last name 10 times. I don't even know, but try it. It's fun. But most of it's going to be unattached if it's not already on the list. If it were unattached, you would type in the physician's name. If it's a medication, you can enter the RX number, and if the medication is on like a vial, you would enter the RX number in the pharmacy. If it's a new medication, you would select new. If the medication is already existent, you can clarify. If you were to clarify, you would choose the medication this way. This one would be acetaminophen. We would clarify the strength, the route, etc., and you would just follow the instructions as needed, okay? Follow the instructions. If you wanted to discontinue the medication, it would be the same steps. This is what you would see. Again, choose medication, follow the appropriate steps. Now, for everything else, non-med would be the option. And then order definition, all your options. Eval treatment, DME lab, diagnosis change, frequency change, plan of care update, anything you can think of is there. The date the order came through. So if you are at the patient's home today on the 19th, but mom says this was 5 days ago, you could change it to 5 days ago. Does it have a scheduled end date? Order details. Maybe this is a short-term order for nutrition. You would just enter it as best you know it in the order details. Verbal order, order confirmed. Now, verbal order, order confirmed. If you had a nutrition order come in from a speech and language pathologist, aerodigestive, a nutrition specialist, that's who you could also say you received a verbal order from. If it was from a patient caregiver, that isn't really acceptable unless it's from like a portal and they show it to you. So order received from should be from a clinician, some kind of specialist, not from a patient caregiver. When that's done, you would hit sign, okay?